Hey everybody, Dr. Scott here, and I'm going to talk to you today about a really important topic that's gaining a lot of ground recently and letting you know what I think about it and what you need to do about it as usual to help your child get better. So, I want you to imagine that you're home at night and it's 1 in the morning and you are in bed alone in the house and you hear a noise. And suddenly you decide that maybe there's someone else in the house. And so you get very scared. You might get up and prowl around looking for someone, or you might search for your phone to call the police or help you. But almost always, what happens in that instance is our senses become a lot more sensitive, as you could say. So we get this um, hypersensitivity. So our hearing improves and becomes a lot more acute. Even our vision, you might be looking down a dark hallway and feeling like you can pick out figures or something. But one thing's guaranteed from that point forward, during that episode, any other noise that you hear, any other thing that you see, you will interpret as danger. You might hear the air conditioner kicking on, and that startles you. Your startle reflex sort of goes up and becomes much more acute. And when you hear something and you think, oh, this is evidence that there's someone else in the house, that will make you a lot more afraid and cause fight or flight to get even stronger. So, fight or flight happens when our sympathetic nervous system gets triggered. We are convinced that there's something dangerous, and your brain basically gives you two choices. You either need to fight or you need to flee or run. So that's where we get the title fight or flight come now from. I can tell you if you're in a situation where your brain is giving you danger signals and telling you to run or fight, and you can't do one of those two things, you'll get progressively and more anxious. So, scenario two, I want you to imagine that there's a cage with a tiger in the cage. And I wouldn't do this, but imagine I took you and pushed you into that cage and then I blocked the door and wouldn't let you get out. Sure, you might cry and be upset, but more than likely than anything, you would get extremely anxious and begin to fight. You would fight me to try and get out. You'd become extremely aggressive. And so, in situations where we are really scared and we're taking in a lot of this sensory information, people can get aggressive and really angry and can act out just because they're scared. So there's a phenomenon that's been making its rounds. I've heard quite a bit recently, maybe in the last 6 months, from parents who have been told by someone that their child has PDA, pathologic demand avoidance. And it goes like this. The parents are typically told, when you're asking your child, you may notice that they freak out when you place any requirements on them. When you say, hey, it's time to transition, to go to bed, to go to school, or whatever. And the parents are then told, your child may have PDA, pathologic demand avoidance. They are told that it is sort of a companion or subtype to autism, and that the solution is that they should just not make demands on their child or greatly reduce the number of demands that they're making on the child. Well, a few things you should know. First of all, PDA is not really a recognized diagnosis. It's not in the DSM manual. And so it is something that's sort of gaining ground, almost whisper down the lane. People are repeating it. Clinicians are even telling parents that this is what's going on, and it's kind of spreading like wildfire. So I think I really want to let you know what's actually going on in these cases. Now, you can, of course, call it PDA. You can call it whatever you'd like, just like any other label, whether we call something OCD or generalized anxiety or ADHD. Those are just kind of lists of symptoms and describing what's going on. They don't help you get out of the situation. So if you think back to my original scenario of being home alone at night when you're hypersensitized, the children that we tend to see with neuropsychiatric disorders are hypersensitized. So the stimulus that is coming into their body is greatly amplified and oftentimes represented as danger. So when they're asked to do something they don't want to do or given a medication, they may react to it in a way that you don't expect. And so when you are in a situation where have an infection or are exposed to a toxin or have a psychological trauma or even a physical trauma like breaking your arm, the immune system gets activated. In some people, when they have certain infections or when they have certain toxin exposures, their immune system stays persistently activated. It's called persistent primed hypersensitivity. So think of it this way. It's as if you are at home alone continuously and you're hearing noises and feeling like it's a dangerous situation. So that persistent primed hypersensitivity can become almost chronic in people. And you may hear people saying, I feel like I live in fight or flight, or my child lives in fight or flight. So, of course, you can call it whatever you'd like, and you can call it PDA if you'd like, but the solution is not to decrease demands. Ultimately, if you have a child or an adult and you no demands are ever placed on you and you never seek to train, to develop, to improve, to rehearse, to do exposures for people with OCD, then basically you end up being the lowest common, denominator ends up being your nervous system response. And so what you really need to do in these situations is turn off the persistent primed hypersensitivity, manage the cell danger response, which I've talked about before. And you do that by eliminating toxins, removing infections, re-regulating the immune system, and that can be done with low-dose naltrexone or transfer factor. Or it can be done with IVIG at times, and rarely, but sometimes steroids can help with this. And then ultimately, you work on some of the behaviors. So when people have this um, issue with sensitivity to activities or things that they don't like and tends to come out as aggression, it's much better to rehearse a difficult situation coming up, kind of make it fun for the child, make a joke out of it in a way, and show them different ways to react to situations that they might not enjoy. You can also do exposures for people with OCD because when you push someone with OCD to do something that triggers one of their intrusive thoughts, and they feel like they need to do a ritual to get out of it, that can be very much the same. And accommodation happens when parents or other people accommodate someone's behavior with OCD and just say, it's okay, you can wash your hands 1,000 times, you can have your specific bedtime ritual. And that just doesn't help people. Because as I look at it holistically, if we say that a child has this PDA, this pathologic demand avoidance, and we say they can't have any demands placed on them, or we have to accommodate them so that they just never get more upset or more aggressive, we've kind of put them in a position where they may have difficulty finding a job or a relationship or really any human interaction just because of that. So the solution here is solve what's causing the persistent primed hypersensitivity, remove infections, deal with toxins, re-regulate the immune system, and then do some behavioral therapies to help the person overcome this. So, PDA as a thing, as a diagnosis, probably really doesn't exist. What we're really seeing is persistent primed hypersensitivity and anxiety, which then is being expressed as aggression. I hope this helps. Have a great day.